In this video, I want to talk all things the ACL. And this video really came about because of an interesting documentary that I watched on Sky Sports News that really went into discussing whether we have an epidemic of these ACL injuries. I'd seen it in our clinics and now seeing it in the mainstream media as well. I think it's really important that we dive into this topic. I want to talk about what the ACL actually is, how it becomes susceptible to injury, what the ramifications are and why there's such a lengthy rehabilitation program in place. But most importantly, some of the theories as to why we're seeing a huge increase in ACL ruptures, in particular in youth athletes and especially in females. We're going to dive into the theories that are put in the media. I'm going to give my views on those. I'm going to give my views on what I think might be contributing to it. But ultimately, I want to let you know the things that you need to do if you suffered an ACL injury, or if you want to prevent an ACL injury, what you need to throw into your everyday life right now. So let's dive into the main content. Firstly, if you are new to the channel, my name's John. I'm a head therapist at John W. Sports Injury. Here I'm a sports injury therapist, and at this channel I want to do three simple things for you. I want to help you to understand your body more so that you can get rid of your pain, weakness, and ultimately strive forward and hit your health and well-being goals. So let's dive into the content. But if this is the type of content that you are enjoying as we make our way through, don't forget to smash that like button because then I can bring out more content just like this. But firstly, let's talk about what the ACL actually is. The ACL stands for the anterior cruciate ligament. Now, our ligament is stabilized by four main ligaments. We have our medial collateral ligament on the inside of our knee. We have our lateral collateral ligament on the outside of the knee. And then crossing over deep in the knee, you can see these structures here, which are our cruciate ligaments. We have the ACL and the PCL. The ACL is the one that sits in front. Now, what does the ACL do? Well, the ACL is in place to really stabilize the knee. So if we see a potential ACL rupture, we will typically see a lack of stability at the knee. How we test this in clinic is we try to move the lower leg bone, the tibia, on top of the femur, the higher leg bone. So what we would see in a normal test, somebody who doesn't have an ACL injury, is that as we bring this leg forwards, this lower leg forwards, we would get a block, a stopping happening because the ACL kicks in. However, if we can get excessive movement over that lower leg, then it's when we start to fear an ACL rupture. Now, what we know about ACLs is that if we want to be returning to competitive sport, it usually or typically ends up requiring an operation. Now, whilst the operation is relatively fast, what we know is the rehabilitation is a long term. When I first began studying and understanding about the ACL, we used to think that it was about a 9-month recovery. However, more modern research has shown that in the 9 to 12-month window, we do run a huge risk of reoccurrence. So now the guidance given is that really there shouldn't be a return to competitive sport until 12 months have passed. Why is that the case? Well, the blood supply that we get to the cruciate ligament is effectively low or non-existent. So therefore, once we make these surgical interventions, we need to allow a certain amount of time for that graft to be fully taken, fully repaired. Now, the grafts tend to come from various places. So if you have a ACL rupture and we have what we call an ACL reconstruction, a surgeon would typically take some donor sites from somewhere like your hamstring or your knee, or sometimes actually cadaver sources, so that they can reinforce that knee. How do we typically get an ACL injury? And this is very important for what we're going to dive in and talk about. Typically, how we suffer an ACL injury is if the lower leg is planted and then we rotate the upper leg. That's what really starts to stress these ACL or these cruciate ligaments. So if we dramatically have a twist on top of a fixed lower leg, that's where unfortunately we can get these ACL ruptures. Now, for me, it is one of the most serious sporting injuries that we can get. And this is really due to the length of rehabilitation time. And what we found is no matter what the level of sport, even at the highest level of sport, Premier League footballers, world-class athletes, we still have to take the year rehabilitation time, even with all the resources that may be available to them. So it's very disappointing that what I was seeing in the clinic and now we're seeing in mainstream media is a huge increase in the amount of ACL ruptures. I mentioned that I made this video after watching a Sky Sports News documentary. I'll link to that documentary below because I found it particularly captivating. But a specialist surgeon explained that for every ACL rupture that he saw in the 90s, he now sees about 29 times the amount. So we've had a 29-fold increase on ACL injuries over the last 30 to 40 years or so. So this is a huge increase, and this can't continue to happen. We need to understand this better, and we're currently piling as much research in as we can to understand these ACL injuries. So why is this happening? And importantly, some of the key demographics that we're seeing this happening in are the youth athletes. We've seen a huge increase, but a really huge increase in female athletes compared to male athletes. So there are a few theories that I'm going to discuss now as to why this might be happening. But what I need to stress from the outset is the truth is that at this stage, we don't categorically know why these things are happening. We have some theories that are being put forward, some theories that are being researched. I have some theories of my own which I'm going to discuss, but ultimately we are still trying to find out why this is happening so that we can correctly advise the ways to stop this happening. But at the end of this video, I'm going to explain some of my views and some of the things that you need to do to stop this happening, or if you have suffered an ACL rupture and you're watching this video, the things you need to do in your rehabilitation program. So, firstly, some of the theories. Well, the first theory is around sports specialization and why this might be happening more in youth athletes. The theory being that perhaps now at a younger age, we're specializing in sports earlier and really putting all of a child's time and effort into that sport, which may then lead to them putting more stresses in those areas and make them more susceptible to ACL injuries. So, when we know the mechanism of injury, the rotation on the planted leg, we know that certain sports might make us more susceptible. Football being a common one, netball being a common one, rugby being a common one. Sports where we're planting and then rotating. So if children are specialising in this sport and perhaps not having a more rounded approach to their sport, the theory is that this might be leading them more susceptible to ACL injuries. Another theory is really around the changes in lifestyle that youth athletes now have. And the theory being that we have less unstructured play and more sedentary lifestyle when we're not following these specialised sports. So what that's relating in is a real contrast. It's believed that perhaps in previous times or previous generations that we did more unstructured play. So in my childhood, I would be running around more, riding my bike more, changing direction more ultimately to strengthen those areas so that when I went into my specialised sport, which at younger age for me was football, I was perhaps more rounded or more globally strong to prevent the risk of a ACL injury. So that's another theory. Another theory that's very popular, and whilst it hasn't categorically been proven, it's really hard to ignore, is around the hormonal side of things. Because we've seen a huge spike in particular demographics, being female athletes and youth athletes between the ages of sort of 14, 16 or 17, it's really hard to rule out the impact that perhaps hormonal balances might be making on this. And perhaps there's a lot of research at the moment into whether the menstruation cycle and the stages that we're at in that can have an effect on an ACL injury. As I've said, all of these currently are unproven. They are all just things being put forward that we are working in to try and find out these answers. I sometimes wonder as well whether a movement towards artificial playing surfaces has perhaps aggravated that. It's certainly something that in my clinical experience, I've seen a higher rate of injuries happen on these artificial playing surfaces. Now, what we know about these is, whilst they may be soft on the top, they are built on a harder surface, and as a result, we may therefore have high impact forces coming up into the knee. And when we have these rotational movements on top of higher impact forces, perhaps this is making us more susceptible to ACL injuries. However, what I want you to understand from this video is that at this stage, we really don't know. These are all just theories. What we want to be able to do is provide the correct advice to prevent these happening. So what do we think we should be doing? Well, the first thing that you need to be doing is not underestimating the importance of a warm-up. We know that we want to make sure that we're as strong as possible and as ready for these dynamic movements. What can happen potentially is if we're not appropriately strong or not appropriately ready for these dynamic movements, is that it leaves us more susceptible to this injury. Now, we know that we injure this by having a rotation happening on a fixed leg. So often I see warm-ups that might just work in one plane of motion. For example, a jog up and down a football pitch, a jog around a netball court. What we're doing there is very much working in what we call a sagittal plane, forwards and back, forwards and back. But we know that actually the ACLs aren't stressed too much in this mechanism of movement. What we want to do when we're doing a good warm-up is see if we can involve all three planes of motion. So that's front to back, side to side, but most importantly, rotation. So a good warm-up will allow us to build the amount of rotation happening so that then we finish a warm-up having competitive level of rotation, so that when we actually go onto the pitch or the sporting environment, the body's able to be ready and well prepared for that. The second thing that we need to do is to not underestimate the importance of a cool down. So when we finish sport and competition, using things like static stretching in order to make sure that the muscles aren't being left in a short and tightened state, so that when we return to sport or training, that we're not putting excessive pressure on the knee. These things are going to be really important as well. The real frustrating thing about ACL ruptures are that we get no warning signs typically. It's not an overuse injury. It's not something that we feel being tight for a period of time and then we get a problem. It happens in a blink of an eye. So we really can't underestimate these small details and the importance of that in preventing an overall long-term injury. But again, some of the theories that have been put forward, the sport specialization, the hormonal imbalances, the changes in lifestyle are very difficult to change. And again, they're only theories. So what we know that we can control are these warm-ups and these cool-downs. And that's why I want to stress the importance of those within this video. Now, if you're watching this and you're someone who's unfortunately suffered an ACL injury, this theory around making sure that you're involving all three planes of motion is something that we want to be doing in the rehabilitation program. The first tip and the first thing that I would urge you, as I do all patients we work with, is that you have to respect the rehabilitation time. I would urge you to make sure that you are taking a year, but this certainly doesn't mean a year of just sitting down, a year of just being away from exercise. What you need to do is embark upon a progressive rehabilitation program that's going to take you through the key stages of building in these planes of motion, building in increases in range of motion, so that when you do return to the sport and exercise field, you are truly ready to be back and do everything you can to reduce the risk of a reoccurrence of this such frustrating injury. I hope that's been helpful. I feel that this is a bit of a more negative video, and I don't want it to be that, but what I do want to understand really is that we're just trying to present the facts. There is a huge rise in ACL ruptures. It is a long-term frustrating injury that we truly have no shortcuts to. So what I want you to take away from this is the positive steps to enhance your warm-ups, to enhance your cool-downs, to enhance your global strengthening in different planes of motion in order to reduce that risk for you so that you can strive forward and hit your health and well-being goals. Has that been helpful? That's a deeper dive perhaps into some of the content that I usually do, but if you found this to be a good and helpful video, you can do me a favor by hitting that thumbs up button. That'll help others see this and hopefully prevent other long-term injuries or allow people who have suffered this injury to return to the sport and exercise field in the most safe and strong way. And if you haven't subscribed to the channel yet, well, why not? Why not hit that subscribe button, hit the bell, and then I'll let you know as soon as I drop our next video. Speaking of other videos, here's another video to help you on your health and well-being journey, and I look forward to seeing you on the next one.